Hello, and welcome to the Equity and Mental Health Framework, addressing the mental health needs of students of color. Today, I'm going to be talking with you about your needs as students and about what you shared with us through the work that we've done in talking with students nationwide to learn more about how to best support you with your mental health needs. My name is Dr. Alfiee. I am Alfiee Breland-Noble, the Senior Scientific Advisor to the Steve Fund, and I'm the ACOMA Project Director, which is a research project oriented in community-based and community-engaged practices focused on depression in teenagers. I'm also an Associate Professor of Psychiatry. So today we're going to talk a little bit about what the Steve Fund is, the origins of the Steve Fund, and just briefly give you some background on the Steve Fund. We want to talk a little bit about what we've learned from you, about what the mental health risks are and what the barriers are that you encounter to seeking help and taking care of your emotional well-being and mental health. We're going to talk a little bit about something that the Steve Fund worked very hard on in collaboration with the JED Foundation, and it's called the Equity and Mental Health Framework. We'll spend a little bit of time discussing why these issues are important to you based on the knowledge that we've gained from talking with young people nationwide. And then we'll share some of the programs, services, and supports available through the Steve Fund. So what is the Steve Fund? Well, the Steve Fund was founded in 2014 as a result of the tragic loss of Stephen Rose, a graduate of Harvard College, and a graduate with a master's degree of City University in New York. After Stephen's untimely passing, his family got together and decided to try to provide a buffer and some supports for other young people nationwide who may be struggling with emotional well-being, mental illness, and mental health concerns. Their idea, the idea of the Rose family, was that colleges and universities could be even more well-equipped to play a vital role in supporting the mental health and emotional well-being of young people of color. The Steve Fund is, as far as we know, the only nonprofit in the nation focused on promoting the mental health and emotional well-being of college and university students of color. We collaborate with colleges and universities. We collaborate with students. We collaborate with parents and families. We collaborate with practitioners and educators and administrators to try to better understand what the issues are regarding emotional well-being, mental illness, and mental health for students of color, and to promote dialogue around the import of addressing these issues in students of color who have been significantly underrepresented in work focused on mental health and emotional well-being. Next, we're going to take a few moments to talk a little bit about the mental health risks facing college students of color. We're going to raise a little bit of awareness about what some of these challenges are, and we're going to talk about key issues. As you can see from this slide, there are about 20 million students, a lot of students in college, between the years of 2000 and 2015. We know that, importantly and relevant for our discussion today, the numbers of African American and Latinx students have steadily continued to rise. We also note that a significant portion of young people report identifying as people of color as of 2015, and that this number increases annually in terms of the numbers of young people who identify as young people of color who are students on college and university campuses. This slide just reflects a little bit of the information on the disproportionate underrepresentation of students and faculty who identify as people of color on college and university campuses nationwide. From an ecological perspective, what we understand is that students are impacted by the institutions that they attend. Those institutions are situated within communities, and those communities are comprised of people who make up the public. And so there's this bi-directional relationship from a campus ecological perspective that helps us recognize that just as students impact the institution, the community, and the public and the community and the institution impact students. When we talk about some of the critical issues facing students of color and students in general on campus, one that comes to mind, I think, readily for everyone is stress. Everyone knows what it feels like to be stressed, and everyone knows that college does not discriminate. And so as we think about these issues of stress, we want to pay attention to a couple of things that are unique and quite salient for students of color. One thing we know is that students of color are more likely to report feeling overwhelmed all or most of the time during their first term as compared to their white peers. This research is based on the work of a young woman named Dr. Vanessa Volpe, and comes from a sample of students from whom she collected data. We also know that college students of color in Dr. Volpe's work report that they are less likely to ever have received, and they're far less likely to remain in treatment for mental illness, even once they do get into treatment and attend. In addition to Dr. Volpe's work, this research around the underutilization of mental health care has been replicated in many studies nationwide. We also recognize that students who report facing sociocultural stressors and challenges prior to coming to campus are going to be more likely to have the stressors of college compound what they've experienced prior to coming to campus than their white peers. And we recognize that students of color are disproportionately more likely to come to campus with a different set of challenges and stressors than their white peers. The Healthy Mind Study is a study that's done annually. It is web-based, and it is run by a group called the Healthy Minds Team, led by Dr. Daniel Eisenberg at the University of Michigan. Some of the statistics I'll share with you now come from the Healthy Mind Study. Unsurprisingly, we understand from this work that some of the most vulnerable populations are young people who come from under-resourced backgrounds, who are first-generation students, and or who are students of color, knowing that students of color can come from either one of the prior two populations. Students who report that they struggle financially or who identify as under-resourced face a unique set of challenges, which is no surprise to any of us. Latinx students in the Healthy Mind Study report higher levels of depression than other students of color, including Asian, Asian American, Black African American, multiracial, or even white students. And finally, in the Healthy Mind Study, it's no surprise that LGBTQA students report higher levels of depression and anxiety than students who identify as heterosexual. Discrimination is one of the most notable stressors impacting students of color. And we know that prejudice and racial discrimination, including bias, implicit bias, microaggressions, and other types of behaviors, negatively impact this population. It's not surprising that racial discrimination contributes to racial disparities in health overall for people of color. We also would not be surprised to know that negative stereotypes reported by Black students, when they report experiencing those negative stereotypes, that it contributes to the creation of an unfriendly and sometimes hostile campus climate. Research shows us that for Black males and Black females, these experiences of discrimination can have negative impacts, including depression, elevated anxiety, and creating a hostile campus environment. What do students encounter? So when students first arrive on campus, they engage in an activity that many people engage in whenever they encounter a new environment. That activity is seeking cultural congruence, seeking cultural relevance, seeking those cultural markers that allow people to feel that their new space is safe. Dr. David Rivera describes one of these activities that's conducted by students as searching for their mirrors. Where are the people on campus who look like me, who reflect my experience, and who can understand my experience at an intuitive level? Students of color also report experiencing overt and covert bias in the form of things like microaggressions. Unfortunately, students encounter things like hate crimes, which has happened increasingly in recent years, and things like micro assaults or physical assaults. You see on this slide a picture of two students. This was from a campaign, a pictorial campaign put together by students at Fordham University a few years ago, where they described some of their experiences with microaggressions in the college and university setting. Some of the impacts of experiencing microaggression are not surprisingly negatively related to emotional well-being. In other words, the more a young person encounters microaggressions, the less positive they report their well-being. Some examples from the literature, I won't go through all of these, but it's not surprising that reports of low self-esteem, anxiety, and depression are reported by students who experience microaggressions. One of the ways in which the expression of the negative impacts of microaggressions is manifested is through somatic symptoms, because in many cultures, it is more acceptable to express somatic symptoms, i.e. physical sensations or physical discomfort or physical pain, than it is to express emotional distress, psychological distress, and that things of that like. Students also encounter, finally, as if the others were not enough, we learn from students that there are many other types of negative experiences they have that are a result of how people engage them and how people perceive people of color on predominantly white campuses. Some examples of what students report include isolation, feeling marginalized, struggling with acculturation. They encounter imposter phenomenon and stereotype threat. And each of these entities, each of these things detracts from what students need the most, which is a sense of belonging, feeling that they have social support, and an opportunity for positive, strong personal and professional mentoring. So when students encounter all of these things, where are they going to seek help? Well, we recognize that, unsurprisingly, family and friends are the places where students turn to most. Also, unsurprisingly, they do turn to mental health professionals. However, it is at a much lower rate. And as you can see on the bottom right, only about 12% of young people who reported seeking any kind of help turned to a mental health professional. They were far more likely, if you go upwards on the right-hand side of the slide, to turn to family members, and in some cases to turn to even school staff. Without question, one of the most significant detractors from mental health service utilization, one of the most significant barriers to mental health care, is this issue of stigma. In communities of color, stigma is a big issue as it relates to mental illness. For some communities of color, there really is not even a language for discussing mental illness, and things are framed when they're emotional or psychological, they're framed much more in physical terms, going back to the comment earlier about somatic symptoms being more acceptable in some cultures than psychological or emotional symptoms. And so it's very unsurprising that stigma is a big barrier and a significant driver of underutilization of mental health care by students of color. The consequences for all of this are quite real. For many young people, the lack of ability to care for their mental health or to have resources that they can access can lead to challenges in their work and challenges in their ability to make steady progress through their academic training. In addition, we find that there are experiences with or challenges around interpersonal experiences that are negatively impacted by lack of mental health treatment and by poor mental health and poor emotional well-being. Students report that one of the additional barriers to help seeking has to do with who's in the counseling center on campus. When students perceive that there is a lack of racial ethnic diversity in the college counseling center, it makes them less likely to want to seek those services out for fear that the people who are providing services will not understand the experience, the lived experience of students of color. Research bears this out in that when colleges and universities have greater proportions of people of color providing services, students are more likely to utilize those services. This slide just reflects the significant underrepresentation of people of color in college and university counseling centers. And this data is from 2015-2016. So, what does the Steve Fund do to support students and by extension families of college students of color? Well, now we're going to talk a little bit about one of the ways in which that happens, the equity and mental health framework. Now we're going to focus on the equity and mental health framework. This was an effort that occurred over a number of years that allowed the Steve Fund to really build up the research base and share some new and innovative ideas with colleges and universities, and that allowed us to infuse knowledge and learnings from students themselves about what's important for supporting your mental health. The Steve Fund and the JED Foundation, two organizations focused on college student emotional well-being and mental health, recognize the lack of organized knowledge about best practices for meeting your mental health and emotional well-being, particularly for you, students of color. We collaborated with Dr. Stephanie Pender-Amaker, a well-experienced and very strong mental health professional. She's a psychologist by training, and she directs the Harvard Medical School McLean Hospital College Mental Health Program and served many years prior to this in higher education administration. Along with Dr. Pender-Amaker, both I, Dr. Alfiee, and Dr. Victor Schwartz, the senior medical advisor at the JED Foundation, met over a number of months. We talked frequently, we had lots of discussions, and we helped to organize the foundation for the Equity and Mental Health Framework. Subsequent to organizing a draft and a foundation for this work, the Steve Fund and the JED Foundation organized a panel of mental health experts. We sought additional scientific information. We reviewed national surveys and conducted a national survey to learn about best practices. And we hosted a national meeting of higher education administrators, all to gain new insights and input for inclusion in our mental health framework. From that, we developed a set of recommendations. And most importantly, within that set of recommendations, we also conducted a national survey of 1,000 racially diverse students with equal samples of African American, Black, Latinx, Hispanic, Asian American, and white college students to give us insights into how our framework could best be improved and how our framework could really seek to meet the needs of our population of interest, which is young people of color. All of this information together went into creating the Equity and Mental Health Framework. So with that, we're going to walk through a set of 10 recommendations and strategies that comprise the Equity and Mental Health Framework, with a focus on how not only the recommendations themselves, but how the recommendations can be implemented to support young people of color. Recommendation 1, more important than anything, it is critical that colleges and universities center emotional well-being and mental health of college students of color campus-wide. It is central to the mission of colleges and universities. It is important and critical and vital for helping students of color make it from beginning their college education to actually being successful in completing their college education 4, 5, or 6 years later. This is also important for graduate and professional students. And so when we speak about making emotional well-being and mental health a campus-wide priority, it really means for all students. Recommendation 2, it's important for colleges and universities to engage students because you have the knowledge and you have the critical expertise that is central to educating colleges and universities and administrators in particular on what you need to be emotionally healthy and to have positive and optimal mental health. Going back to the idea of the mirrors that we talked about earlier, that my colleague, Dr. David Rivera, a university professor in New York, as well as an advisor to the Steve Fund, talks about frequently, we have to have culturally competent faculty and professional staff. And not only do we need culturally competent individuals, but we want to ensure that the faculty and staff reflect the racial, ethnic, gender, and sexual orientation diversity that is present in the student body. And one of the most important ways to do that is to not only recruit individuals to campus to serve in these professional roles, faculty and staff, but to train them in culturally competent practices, whether that's education, whether that's healthcare, or whether that's mental health care, and to retain these individuals so that as each new group of students comes into the college and university setting, they can see their own mirrors. Recommendation 4, it's important for colleges and universities to recognize that you all as students of color are faced with issues not only within your campuses, but the issues that are going on around you both nationally and internationally. So when we think about recent current events, like the big event that happened in Charlottesville, Virginia, or the international travel ban, or other things of that nature, we recognize that students don't just live in a microcosm of the college and university setting, that they have friends at other campuses, they have friends who are not in college, they have loved ones and people they care about, both in the United States and abroad. And so when things happen on a national and international scale, it's important for those things to be centered and brought back to students and give them an opportunity to engage, to discuss, to protest if necessary, so that they can remain connected to the communities that have supported them in bringing them to college and helping them get through college. Recommendation 5, it's important for students to have persons on campus, not only who reflect them as mirrors, but who are in positions of power to support them. It is also important that there are multiple persons with dedicated functions and dedicated roles as administrators whose job it is to oversee and help positively and effectively manage issues of diversity, social justice, multiculturalism, and disparities reduction. Ideally, these individuals who are given this charge have relationships with senior level administrators on campus so that as they need access to resources and supports, they can readily access those in service to the students. Recommendation 6, it's important for colleges and universities to have safe communication mechanisms for students to report and to have active and effective follow-up so that when things are reported, the college and university can respond effectively. Recommendation 7, not all students value or feel comfortable with the 15-minute med check or the 45-minute clinical hour. In response to that, it's important for colleges and universities to provide multiple ways for students to engage so that they can be supported and receive the kinds of programs and services that are going to empower them and help them care better for their mental health and emotional well-being. Recommendation 8, so many students are tied to social media. They have smartphones. Students of color in particular are overrepresented in proportion to their numbers in the United States among those who have smartphones. So because so many students have smartphones and rely on those smartphones and devices as means of communication, it's important for colleges and universities to be able to build on that knowledge so that they can more effectively share information on what they offer on campus to support emotional well-being and mental health with students. Just a note about our research study conducted with Harris Poll. We found that in our sample of 1,000 students, just under half reported that they felt that students were reached effectively through social media by their colleges and universities. Recommendation 9. As a researcher, what's really important and interesting and vital to me is understanding how well different approaches work to support the mental health and emotional well-being of young people. In that vein, it's important for colleges and universities to collect data on the programs and services that they provide so they can better understand the effectiveness of those programs and services. In doing so, they can help build out the database or the information available to other colleges and universities around culturally relevant and promising programs and practices. So the more colleges and universities can really study and better understand what it is that they're doing that works well, as well as what it is that they're doing that could work better, the better it is for all colleges and universities, and the better it is for students, because we have rigorous information to help us design, improve, and expand effective programs and services. Finally, the Steve Fund and the JED Foundation feel it's really important for colleges and universities to share information. If you're doing something well on your campus and it seems to resonate with students, it's critical that that kind of information be shared with other campuses because, for example, a program that benefits Latino or Latinx students who are struggling with anxiety may translate to multiple campuses and may be adaptable so that it reaches and is relevant for other populations of students of color. But if that information isn't shared, it makes it very difficult, and colleges and universities may find themselves having to reinvent the wheel. So those are the 10 recommendations from the Steve Fund and the JED Foundation, referred to as the Equity and Mental Health Framework. You saw a link on each of the slides to equityandmentalhealth.org. That will help you find a downloadable PDF of the framework itself, and you are free to download that and share it with people within your circles. You can share it with your friends. You can share it with administrators or people whom you value. You can share it with parents and loved ones. But we also want to highlight for you some of the programs and services offered by the Steve Fund. One in particular that's relevant for students is that the Steve Fund can come to your campus and can talk with you about how to better care for yourself. There are all kinds of workshops and programs available from the Steve Fund that you can find on the website. I will show you a web link at the end of this webinar, but we encourage you to look through it to see if there are things that resonate with you. The Knowledge Center is another space where students can go. This may be particularly relevant for students who have an interest in studying some of these issues around health disparities, mental health disparities, underutilization of mental health care by students of color. And so the Knowledge Center is a place where you can go to find things like expert presentations, you can watch videos, other webinars similar to this one on various topics, or even pull white papers to give you snapshots or an overview of different aspects of mental health and emotional well-being for our population of interest. In the unfortunate event that you find yourself in a crisis, not a life-threatening crisis, but a crisis where you feel like you just need someone to connect with briefly, the Steve Fund has partnered with Crisis Text Line, and many of you are probably already familiar with Crisis Text Line, but there's a special keyword that you can use, STEVE, Steve, to get you connected with Crisis Text Line. And it also helps Crisis Text Line know that you're a young person of color who's calling in, and so they can ensure that the person you're connected with is a well-trained, culturally competent provider. This is just an example of a webinar of the many webinars available on the Steve Fund website, and this might be something to share with family members, parents, loved ones, guardians, parental figures, that can help them learn a little bit about what your experiences are on college campuses, so that you don't have to explain it, and so that we can be supportive, we at the Steve Fund can be supportive of you and help translate some of that material on your stressors and on your struggles to the loved ones around you. If you're interested in more information about where the Steve Fund has been profiled, you can feel free to go to stevefund.org/news, and there you will see articles and references to the Steve Fund from esteemed publications such as those you see here. Finally, we want to also direct you back to the website for all of the different types of information I shared previously, but to also encourage you to engage with the Steve Fund, because there are many opportunities for young people like you who are leaders, who want to develop professionally, and who have an interest in these issues, both as an advocate or as a support for someone you love. So we encourage you to visit the website to learn more. Finally, we'd ask you to share your feedback on this webinar, what's missing, what the gaps are, what we did well, what you'd like to see us highlight more. We'd love to have your feedback. And so if you go to this web link, which is also accessible from your smartphone, we'd love to learn more from you. With that, we want to encourage you to please connect with us. There are multiple web links here. The main web page, as I shared earlier, I would remind you of the Equity and Mental Health webpage, where you can download a PDF of the Equity and Mental Health Framework and disseminate it widely. There's also a link on the Steve Fund website for how you can become involved with our Youth Advisory Board. We thank you so much for your time and attention. We wish you all the best in your academic endeavors. I personally, in signing off, Dr. Alfiee, wish you well, and I thank you for your time and attention.